Welcome, everyone. It's nice to see some new faces here. I very much appreciate your time for the next hour. My name is Ruby Wynn, and I will be the discussant today. We're so very pleased to have three community leaders with us to discuss their community needs, what they're up to, and potential collaboration, not only for research, but also for training and education. This has been a long time coming. Part of this series is supported by the University of Minnesota's Faculty Idea Grant and the Office of Diversity, Equity, and Advocacy. I first wrote this small grant in December 2019, and clearly our worlds looked very different then. And what I had originally imagined is something that my human rights colleagues call a salon, that we would get together in a nice setting, maybe have a nice drink of our choice and be able to speak human to human and discuss really what we needed to do in order to make our work impactful as it relates to our local communities. And our work being both our research work, but as well as our in-class teaching and mentoring work. And that can include anything from having guest lectures to a more diversified reading list to having community leaders come and help develop some of our lessons so that we better prepare our students for the world that's out there and our needs going forward. But clearly that hasn't happened. So here we are on Zoom again. So I hope that you have your favorite drink with you and that you can cuddle up to your monitor, and we're going to go ahead and get started. I should also note that this is a part of what our division calls in-service. In-service, the way I look at it, is a very hands-on or practical approach to our seminars. And we have an in-service every third Friday of the month. This is a little bit of an exception in that this week and next week, so we have a two-part series this month, but this week and next week will be in-service speakers. And next week will be on a very similar topic. Next week we'll have representative, she is a representative of the Minnesota State House, Representative Ruth Richardson, speak about her work with the Wayside Recovery Center, which is devoted to recovery efforts among women. So please join us if you're interested in hands-on work and hands-on seminars for our in-services. So let's go ahead and begin. We are so honored to be hosting three community leaders representing two community organizations. I'm going to go ahead and read all of their bios now. The way that this is formatted today, we're going to start with the neighborhood community health source, and then move into Centro, but I'll read all of the bios now. So we're honored to have Ms. Leslie Procopio, who is a community health educator with us. Ms. Procopio began her employment with the neighborhood health source in February of 2018 as a patient receptionist. Her prior experience included 8 years in customer service. In June of 2020, she was promoted to a community health educator. Ms. Procopio is bilingual in Spanish and English and is committed to serving her Latinx community. With her is Tessa Wetjen. Tessa Wetjen began at NHS in May of 2021 after 4 years as a program officer with the Otto Bremer Trust. Ms. Wetjen has a Master's of Public Affairs from the Humphrey Institute and an undergraduate degrees in mathematics and government from New Mexico State University. Tessa has directed faith-based nonprofit serving youth and families, provided refugee resettlement services, led a community health worker team working in East African communities, and implemented statewide strategies to connect pregnant and parenting women with mental health services. And last but not least is Roxana Linares, who is the executive director of Centro Tyrone Guzman, a multi-service Latin organization in Minneapolis. During her time with Centro, she has led the development of a Siembra Montessori, which is the only dual language Montessori early learning center for low-income Latina families in Minnesota, and the implementation of an intergenerational learning community in the organization. Founded in 1974, Centro is the oldest and largest Minneapolis-based multi-service Latina organization. Centro's goal is to decrease the opportunity gaps that affect Latinas in the areas of health and education. So welcome all of you. So first up to speak today will be Tessa, and we'll follow Tessa's presentation. Sorry, one more thing. We hope that, again, that this is a practical experience for us all. And one thing that we'd like to do is to introduce us to the community engaged grant opportunities and learning opportunities that there are for us out there. So I'm going to share my screen. And our DEI committee, particularly Colleen, has developed for us a set of slides that highlight what the university, some university grants that are community engaged in nature. And what you'll see from this list, and if you look in the chat, you'll have a link to it as well. What you see in this list is our grants ranging from $2,000 up past $200,000. And some are university initiated and some are community initiated. So we thought we'd bring these together to you, for you, as a source, as you think about these community organizations and possibilities with working with them. In addition, for the students out there, these opportunities oftentimes, particularly for the smaller awards, can be student-led. They might be needing a faculty supervisor, but they can be student-led. So keep that in mind as well. And here's another one. Again, these 3 slides of grants will be available to you through the link. And then lastly, there is some money also related to DEI initiatives as they relate to teaching and education, as well as other training and learning opportunities for the faculty and TAs. So here's a list of opportunities through the Center for Education and Innovation for fall of 2021. So taken up enough time. Tessa will be the first to speak. And take it away, Tessa. Thank you so much.
Thank you so much. And we are just so thrilled to be able to be here. I'm going to just try to do a little bit of an overview of what Neighborhood Health Source is and what we do. And then I'm going to have Leslie talk about her role and what we do with the community health educators and community health workers. So I'm going to share my screen. So we are Neighborhood Health Source. We are what is called a federally qualified healthcare clinic. A community health center is another term for it. What those are it's a special designation of a clinic that provides additional funding to be able to serve people who are uninsured. And so our population is about 25% uninsured. We have 4 locations. North Metro is up in Coon Rapids, but Fremont in North Minneapolis, Sheridan and Central in Northeast. Oh. Try to advance here. Sorry. Oh, there we go. So our community health team, we do have a full clinical team, providers, nurses, all of those things. Our community health team has 2 areas. We do outreach and InReach. Without InReach, we have panels of patients, so particularly around diabetes, hypertension, and cancer screening, in which our community health workers do follow up with a specific group of patients. Mostly to provide education and to encourage them to come back in for more appointments or for follow-up appointments as necessary. In outreach, and all of this, certainly InReach and outreach, to be clear, is led both by what the needs are in our community and what funding is available. I mean, that's just the truth of how community health works. And so we have been really lucky at Neighborhood Health Source to be able to have some really consistent family planning and STI prevention grants that have allowed us to develop a really strong program in that. And so we have on-site and in the community testing and consultations, and we can provide free family planning visits. So that's a fairly large body of our work. And then we also do classes in the community, primarily youth classes in high schools and middle schools. We do pop-up clinics, and we do a variety of other partnerships. And really thinking about the effective community, here's 3 of our community health workers right here. When I think of what they are doing that is the most effective. I think about their abilities to build trust, to understand the barriers, the reasons why people aren't served, to be creative. They are committed and they really understand the goal. Our staff understand that their goal is to get people connected to primary care and prevention and to live healthier lives. And they really truly understand what the barriers are for people in their community. And that's been huge this year in COVID, right? Because the barriers are distinct and different in different communities. And it's been really helpful that they not only understand it, but are committed to helping overcome those barriers. This is just one example of our work. I think our Seen on the Streets STI testing is super interesting to me because it dipped a little there in COVID, of course, but we're getting back up. And what happens is, and it's just fascinating to me because when I started this, I didn't believe that people would actually do it, but people just come into our clinic every day for STI testing and to talk to a community health worker and get education. And it's drop in and it's not, we just did at Open Streets Broadway, we did 5 tests with people just walking down the street. So it is working in a unique way that I am surprised about, but really excited about. Another example is something we do as a partnership with Park Nicollet, where they bring out their mammogram bus, and then Leslie and Ethel Livingstone really work hard to get women here to get their mammograms. So we did this yesterday, 2 days ago, Wednesday, and had 26 women get mammograms between 8 and 2 p.m. So thinking about the InReach, I just kind of wanted to give you a little snapshot of what it means to try to do care coordination with community health workers, all based on grants. And so we have 250 people in the program, so 250 patients that we've identified as having hypertension and specific needs for follow-up and for support to be engaged in their treatment. But this is what's happening. Like I have 5 different funders that are putting together the money to allow us to have 2 staff half-time on this project. That means I have 14 reports a year with different data, and it's getting us $147,000, which helps us pay for the blood pressure cuffs to give to everybody. But staffing wise, these are all the different staff positions that are involved in some way. And the only people I'm getting funding for, that we are getting funding for, is the community health workers and the quality manager. So I just kind of wanted to show that to you as an example of this kind of work can be really complex. Those grants and funding opportunities all have different deadlines. Not a single one of them has the same deadline. So the amount of reporting and changing and funding, putting together the funding puzzle is really complex. So Leslie, I'm gonna let Leslie talk a bit about what she does. Oh, Leslie, you gotta unmute.
Okay, so with blood pressure, the hypertension, I normally will call the patients like at the end of the month. So I try to keep it consistent. And then just follow up with whatever notes the provider had given them. A lot of the calls is just reinforcing just to keep track of their blood pressure because everybody has busy lives. And the good thing that we're doing is that we're showing them that we're still connected, even though there's some people who can't come into the clinic all the time. And we are doing a lot of telehealth. And so it's just letting them know that we're still there for them. And then with outreach, with working with outreach, what I've seen is that it's out in the community, we're able to connect people with those services. A lot of the people I've talked to, especially like the Hispanic community, that doesn't know about our services, and especially with like the COVID vaccines. One thing that has been lacking in the Latino community is the access to either internet or resources to know where they can go, or if there's a fee, and the information about the actual vaccines. So one thing I've noticed is that a lot of the Hispanic community does not actually listen to local news. So they wouldn't be able to know that they can go downtown or the MOA to just get the vaccine, or just to like a Walmart. And especially with us, it's just like this walk-in, like we do the walk-in clinics too. So just offering our services and educating.
Thank you. And so just what we would like you all to know about community health from our viewpoint is that we really feel like our community health workers, our frontline staff are the experts in their community. They know, and they know not just the reasons why things aren't working, but they know the reasons why things are working. And the need of the person is so much more important than any fidelity to model. And I say this because I came out of, before Otto Bremer, I was at the Department of Health, and I've been around a lot of models, and not all models are built for all families. And I just think specifically about my time on the fringes of family home visiting. And when that moved into a space where every mom was in the home with 5 kids, and the model said you had to be with the mom and the kid, but not the other kids. Or, I mean, there's so many different pieces of models that can really get in the way of how life actually works. And that's something I've been either tangentially or professionally involved in public health for about a decade and a half. And the difference between sort of the model or the ideal and the real life is can be pretty big. Those gaps can be pretty big. And it's really important for all of us working those programs to understand those gaps and to be able to speak to them, as opposed to trying to like wedge things into a reality that doesn't exist. And then additionally, we wanted to just say proximity and familiarity with the target population matters. If you don't understand the context, your solutions don't make sense. And possible research needs. So personally for me, we are working, Leslie's working in this hypertension project using remote data and Bluetooth data. And I don't have any best practices around how to use CHWs in remote data projects. And so I'm wondering sort of, do those exist? The other thing is we actually recently have received a couple of grants. So Leslie and 2 of our other community health workers are now working in support of and part of the behavioral health team, which is a little bit new in the community health worker world. I haven't seen that a lot, and I would love to understand more about the best practices and processes with that. You know, a long staple of public health has been the community health fair, and I can't imagine I'm the only one that wonders if those work at all. Like, you know, there's effective, like, and now that we've gone, so we were trying to do them online and now we're back to doing them in person. And honestly, I don't know, like, I don't know if those are an effective tool for reaching people. I don't know how to identify which event is effective or what I'm even wanting. Like, is it effective that we're just doing education? Does it have to link to a person coming to see us for services to consider it effective? I don't know. And then one thing that I'm super interested in is the resources to move staff from community health level and from the entry level jobs into public health leadership. So I'd say we have 7 community health workers who are amazing working here. And currently it would be hard to say that anybody is on a accelerated path into the professional public health leadership world. And I think they all could be. And so we certainly as a team are looking into ways to doing that, but I think a more a concentrated effort. We all know that in our communities, there's tons of people doing this real community level work who could be also getting paid a lot more and doing some of the decision and the structural work also. And so that's something I'm really interested in. And that's our contact information.
Thank you so very much, both Tessa and Leslie. I very much appreciate it. We have a few minutes if we have any questions for these 2 community health leaders. Go ahead and unmute yourself if you have any questions.
Oh, hi.
Hi, this is Kamakshi. I just wanted to say I was really excited to see Tessa speaking this morning. We just have made a connection with Tessa a few months ago, and we are starting to work with her on deploying our mGlide project at neighborhood. It has been deployed at other FQHC. So we're kind of excited to have this really nice partnerships. And I'm really happy to hear about the community health workers because they're a key part of, helping patients take charge of their own care.
We're excited to get going. They're helping, a big part of the blood pressure cuff project.
Anyone else? Okay, then I'm going to ask the question that maybe other people were thinking. Tessa, on the slide that you were introducing Leslie on, Leslie, what was going on in that photo?
So that one we were doing an education, I believe it was the blood pressure one. So
Nope,
just showing.
that was the
No,
condom one.
that was a condom one. Okay, so the like seen on the streets. So the STD testing, that's the education we were doing.
That's also something we do to test anybody in an interview. Can you explain how to use a condom on this wooden thing without freaking out?
Perfect.
Leslie does a great job.
Thank you both. And we're actually going to revisit conversation with these two after Roxana presents. So welcome, Roxana. Nope. Could you unmute yourself, please?
Hello, everyone. I'm going to share some slides today. I'm very happy and honored that I was invited to do a presentation for you. So thank you, Ruby, for the invitation. Centro, Tyrone, Guzman supports Latina families since 1974. I want to explain the E in Latine. We use it to include people of all genders because we write in Spanish. If you look in our web, we use the E instead of the X because it would be very difficult to pronounce if we were to use the X in all the text that we need to use in Spanish. Our goal is to decrease the opportunity gaps that affect Latinos in the areas of health and education. And we have programming for newborns, children, youth, adults, and elders. So basically the whole family. Key elements in our programming are a Montessori philosophy that we integrate across all of the ages and the services that we provide, and an intergenerational approach. We believe that this promotes engagement and strengthens our community, improving the quality of life of the members in the family. Something that is very important for us as well is that in our programs we include everyone in the family. So if a person comes to Siembra Preschool looking for childcare, the staff will ask if there are other members in the family that would like to join our programs for elders, for youth, or for adults and parents. I'm going to talk very briefly about some highlights of our programs. One of the areas that we work on is early childhood. There are two big areas in our programming. The Centro's maternal health program, we just started a Montessori home visiting program, providing individual support, resources, and tools for mothers. And our goal is that babies should thrive. Consistently, 100% of babies from families in our program have been born healthy. And it's only in 2019, and we believe it's related to the stressors that the moms have experienced, that that percentage has gone down. The Montessori home visiting program curriculum was developed in partnership with the University of Minnesota. Sobeida is a professor at the U and also a board member of Centro, and she has been instrumental in developing this home visiting curriculum. We also have partnered with the St. Catherine University and very importantly with the Montessori Center of Minnesota, as well as community members, to develop a curriculum that is very relevant, up to date, and specific for the community that we want to serve. Also, in our early childhood programs, we have Siembra Montessori, is the only dual language, Spanish-English, Montessori child care center that serves low-income Latino children in Minnesota, as far as we know. 95% of our families receive tuition assistance, and we are so proud that children are ready for kindergarten. They are reading, writing, and doing math, both in English and in Spanish. In our youth program, we have two areas, the VF School program and the Raíces Youth Development programs. In the VF School program, a partnership with Hennepin County and the Minneapolis Public Schools, we consistently have over 69% of increase in attendance of children and in families that we partner with. In the Raíces Youth program, some of the outcomes that I wanted to highlight for you is that Latinas are very proud of their identity. They have connections with adults that they trust, and they want to actively contribute to our community to make it better. One of the groups in our Raíces Youth program is Colores. And I highlight this because it's an initiative that we have only started 2 years ago. And we have been able to recruit teams and allies and basically launch a campaign within Centro and in the community that we serve, promoting inclusion. One of the things that in our research and work with the advisory council we found is that for the Latino community here that speaks Spanish, there is not even a consensus or information of what these LGBTQ things mean. So we started at the very basic, preparing posters, explaining what does it mean, what is gender compared to sex, why do we use the E, and so on. In our last virtual training, we had over 30 families attending a workshop specifically about inclusion for LGBTQ, how to support teams, how to talk with your team, and if they are coming out, how can a parent be the best supporter of the young person. And this is very important for us because we know that the rate of LGBTQ youth that is homeless is very high. Another program I wanted to highlight is the Manos Montessori. This is a micro enterprise in which elders and youth work together to create handcrafted material for Montessori educational boxes. You can see the elements in the first prototype. This was a gardening box, and the elders and youth created the apron, and other material for the parents to work at home and also here in Siembra Montessori. This is another example of the beautiful material that they have created. It is used in the area of practical life. The goal is twofold: provide and bring Montessori, which we think provides really good quality education, not only in Siembra, but also to the homes of our program participants. And the second is to have some income if we can sell this material to other Montessori centers or to other families that want to implement Montessori at home. Another piece in our intergenerational programming is the work that elders and Siembra children did together in their intergenerational medicinal herb garden. They met many times. Elders explained the use of medicinal herbs in their home countries or in their families. For example, chamomile as something that could relieve some stomach pain or help relax before going to bed. You can see how attentive the children are as elders were telling them about their experiences. And then all this knowledge that was created together was compiled in a book that is available, that is going to be available online along with other books that we have created. and will be for sale in a very limited basis as well. In our adult and aging programs, we have elders, care partners. Some people talk about them as caregivers, but we refer to them as care partners, and parents working all together with Centro staff to care for each other, to advocate for the well-being of our community, and to bring awareness of challenges our community faces. You can see some of our elders doing a Montessori activity, which is arranging flowers for the environment. One initiative that we enjoy very much because it's an excellent tool for the community is Baúl de los Recuerdos. This is a memory box. We have a group of care partners, elders, and their families together at Centro 2 years ago, and we based our Baúl de los Recuerdos in the work that the National Museums of Liverpool, the Minnesota Historical Society, and the Alzheimer's Association were doing to increase the range of tools available for elders experiencing Alzheimer's, dementia, and other memory loss. The idea is that families collect photos and objects that are very special to the elders. And as you may know, elders that experience Alzheimer's start to shut down and stay away from conversation. But with these memory boxes, families can take these objects and start conversation with the elders, and you can see how they come to life and tell many times the stories to their kids that they have not, that they didn't know before, experiences that their parents have had in their home countries when they were young, etc. So it's a beautiful tool that not only helps the elder, but also in our experience has helped unite the families. Alongside this tool, we have a toolkit developed as part of the partnership with Minnesota Historical Society and Alzheimer's Association called Colossalcorazon. We worked with elders, interviewed them, asked them to help us learn more about their experiences as people that are experiencing Alzheimer's. You can see some photos of the families in the exhibit at the Minnesota Historical Society. And the name is because our staff is so committed and dedicated to provide every resource and support to our elders that one of our program participants said, you look at us with the eyes of the heart, and the phrase stuck with us, so we named this initiative based on that comment she made. And very soon we will have a release of the documentary of all these interviews that we made with program participants. Before we started this initiative, in our community, Alzheimer's was something that was not talked about, and many families were completely devastated and almost, and other times in denial when they heard the word Alzheimer's in relation to a person they love. But with the work that we've been doing, we have created awareness that the diagnosis is not the end of the road, and on the contrary, elders can contribute for a very long time, and we can do a lot of things to engage them, even when they are experiencing Alzheimer's. So of all these programs and interventions that I have explained to you, the idea came about that we can train people, provide education, provide resources, knowledge, etc., so that they can help us have a broader impact in the community. So we are creating an initiative within Centro where we have Conductors de Educación y Salud. And I want to point out these two areas because I think many times we hear about promotoras, And I love the work that they do. And in my experience, it's mainly related to health. So we wanted to include the area of education because we want a wider and more holistic approach. So Conductors would be Latino community members who have a passion for learning, that are willing to share knowledge, tools, resources that we will provide for them and with their support, and that are committed to contribute to make our community a better place. So in this context, the ideas that we would like to share with you and research opportunities would be related to a literature search of similar work, again, both in the area of education and promoting health. What would be the best practices if there are programs that are already created, and to help us evaluate our pilot. So thank you so much for your time, and I would love to answer any questions that you may have, or if you have comments about what I told you, I would also love to hear.
Wonderful, Roxana. Please unmute yourself if you have questions.
Buenos días, Roxana.
Buenos días.
I am Clement Welgax, and I work for the university for a research study named 10,000 Families, 10,000 Familias. And so I would like to learn a little bit about your experience with research studies at your center. Do you do a lot with the university? How can we help? How can we connect with you? And I don't know, maybe help, support you, and of course, find families that want to participate in our studies.
We have worked for many years with the University of Minnesota, particularly in two programs that may resonate with you: Jóvenes Informados Padres Preparados, or Jóvenes Preparados, Padres Preparados, Jóvenes Saludables. This was a partnership with many programs at the U, including extension and I believe is the medical practice program. We prefer to work in a community-based participatory research way, in which the community members are the ones bringing to the table the need, and then we can have experts both from the community, which would be very important to highlight, and from the university working together to solve a problem or a research question that the community needs answered.
Thank you.
We received a general question earlier, and I'll ask it again here, which is, how open, Roxana, are you to working with graduate students?
We usually have between 3 to 5 interns from different universities. We work a lot with McAllister College. So when we do participatory research, I think that is when graduate students have more opportunity to work with us. We are very open to that. And I would love to have young people help us in our mission.
And I'm so glad that you described your interest in CBPR. So that applies, I think what I heard was it applies to all projects, including student-led projects as well.
And when I say young people, it's young people at heart.
And I don't,
Go ahead, Diane. We're having a little bit of a hard time hearing you, but go ahead.
You know what, I'm in my car, so if it's too hard, I'll get off. But I was struck by a comment earlier on where someone asked about, the comment was made that we often have to adjust our model to work with communities. And I just kind of laughed out loud because as researchers, we have these strict models and protocols, and they often don't work in reality. So I was wondering if we could hear from the experts on the panel or people in the audience about suggestions they have for meeting both the needs of the grant and the needs of the community.
Thank you. So
Yeah.
Can I just quickly summarize for those of you who might be relying on the transcription. Diane is asking for suggestions from us all regarding what models should be used.
Well, so I will say, because I think the comment came from me, I think when we create, so often we get into a position that this happened a lot at the Department of Health where they said, well, that's what the grant says we have to do. And you have to come back to, like, you wrote the grant. So when we write our grants, when we write our proposals, we need to write in there the flexibility for what happens when the program is supposed to be done with 1 2-year-old and you get there and there's 3 2-year-olds. You know, like, we have to write in the flexibility, understanding that the community is not going to, it is more often going to not fit the model than it is going to fit the model. And I think I just read something where it talked about how every week is not a normal week. And that's definitely like our concept in mental health, like, or in community health, like every week something different and interesting happens. And so I think part of it is to write our models and our trials and our studies in a way that allows for some differentiation, because it isn't going to work in the way we think it will. And I think too, so I think back to my time working on anti-smoking proposals and policies, where, you know, we were getting these anti-smoking proposals passed and they were like, oh, now we have these laws passed, so now no one will smoke. And you were like, oh, that's not how life works, right? Like, people are still smoking. The rule is nice, but it doesn't actually, it's the implementation that matters. And I think that's what I get back to with all of the models that we create and all of the proposals and the research. The model is nice, the implementation is what matters. And if we're not, and we need to give people the flexibility to be able to implement for how the community needs it.
Thank you. Roxana, would you like to add to that?
And that's why I mentioned the community-based participatory research, because from the start, we have the community input and their take on what can work or not work. And also I feel that model invites to that flexibility that Tessa was pointing out, and I completely agree with that. Because you have both PIs, one from the community, one from the university, working together, and the whole grant is written with that approach that things are going to happen, like Tessa mentioned, and we just need to address them as they come.
Any other thoughts on types of models to use? Any other question? Tracy, were you about to speak?
Yes, thank you all for your presentations today. I really was happy to, learn about ways of connections between, our school or the university and some of your organizations. But one of the things that I always struggle with is how do we create sustained connections? So participatory research is one way if we can find ways to collaborate, but how do we find better ways to bring lessons that you have in the community, like Tessa, the points you're making, into the classroom? How do we help connect our graduate students who may be looking for, along with support from faculty members, wanting to help people evaluate pilots? I'm just curious if any of you have some suggestions. I mean, we're always in the ivory tower, that's what we're talking about, but many of us are very interested in building better connections with people out in the field doing the work.
Do you want to start, Roxana? I can.
I think one barrier is the financial requirements and commitment from the community organizations, because in my experience in the past, and I don't know if this is still happening, whenever we applied to a grant together, there was a big amount that was the grant that already went to the university administration. So whatever was left and needed to be for the project, and many times even from that amount, the payment for the community to do the work was not enough at all. So we as an organization have many times not even applied and not even considered grants where our work, our specialty, our experience is not going to be recognized because the translation of paid work would be the recognition of the value that our community members' expertise is bringing to the table. So I think financial distribution of resources is a big barrier.
I would say two other things. One, it is oddly hard to get a hold of you and your students. So I always, in my jobs for 15 years, have had distinct projects that I would love a volunteer master's student to come do. It is only when I have time to Google extensively and figure out who it is at the college to ask and get my name on a list that I've ever actually found students. So literally, like if I go Google now, how do I get a master's public health student to help me with a project from the U? There isn't an answer. Like the way that I connected with your students is that I happen to know Professor Yen and somebody in your alumni department, and I emailed them and was like, how do I get this in front of students? So I think you're making it a little bit too difficult for organizations to find you. The other thing I would say is my experience actually at Humphrey in doing my practicum was there was one professor, Professor Maria Haggerty, I think is how you spell her last name, who developed a long relationship with the Office on Homelessness at Hennepin County. And because she had this super long relationship with them and was providing them with data that they needed, she had the connection to get us into all the data right away. And so instead of saying like, come do whatever practicum, she would put up in the course description, like, this is what you would be doing, is a quantifiable or qualitative analysis of something for this program. And for me as a student, it was a lot easier because I didn't have to figure out what the project would be about. For the organization, it's super nice because they get this ongoing influx of data and reporting that they can use for their work. And I believe that because the professor did this for many years with the same organization, with the same data sets, it provided her with this huge body of research. And so I think that ongoing relationship that she developed really benefited students. And I think it helps the organization a lot more because you're consistent, you know, you're going to get something. And because we have projects that come up throughout the year, right? And so I need to, if I'm going to use students, I need to figure out which of those projects are distinct and work within the timeline for the classes, which is a lot of barriers.
Thank you both.
Any other questions? Well, one of you had brought up the idea of working collaboratively to move community health workers into public health leadership positions and to best prepare them for that. And I will tell you that people are already on it. I have received ideas already in the chat box. But one of the questions I'll just read the question. So this is actually posed to us as a university committee. What opportunities are there for universities to help this university to help provide community health workers with credentials that would help them into leadership positions? So the suggestion was, for example, some public health courses, also the public health certificate program. But I believe, please someone else correct me if I'm wrong, the public health certificate program requires that they have obtained a bachelor's degree. Does anyone know for certain? If not, we'll look into it. But Tessa, we are thinking about it, and it seems like there is interest here in furthering these discussions on how to do that. Another suggestion, simply because I teach in the Summer Public Health Institute, those courses with credits. I don't think that there is a restriction on being a bachelor's degree holder. In fact, I know that there isn't. So there are systems in place to further develop your ideas. So I'm sure we will be following up on that. Any other questions before we move into some standard questions that we had for them? So the first question I'd like to pose to both Roxana and Tessa and Leslie as well is, when we think about our graduates, we want to make sure that they're well prepared to meet the needs of our community. So what are the most important skills that you think public health professionals should have in order to effectively work with your community?
I'm going to ask Leslie, do you want to go first? Do you have some ideas? Okay.
I can think about some, particularly with the population we serve. So I don't want to speak for all communities because every community would be different. The community we serve are recent immigrants that have little formal education, maybe up to 3rd grade. Speak primarily Spanish, although Spanish may be already their 2nd or 3rd language from Quechua, Nahuatl, or other language. That have an experience in their countries that is completely different from the systems and experience in the United States, and that face many barriers created by the systems that are created in this country to serve particularly middle class white people with high school level of education at least, and that are literate in technology. So I think all the systems that we have in this country are geared with that person in mind. And so everybody that doesn't fall into that bucket finds many, many challenges to access services. And so a graduate from the University of Minnesota that does not understand these barriers exist will find it very difficult to provide support to families. The other thing that we want to encourage in staff and volunteers to come is that empathy, putting themselves in the shoes of our program participants and not judging based on experiences or stereotypes that they may have had of particular community member. So soft skills are something that are very important, and many times universities don't have the time, or they are not included, as far as I know, in curriculum.
I think it is. So early on when I was hiring people, one of my friends said, well, we don't ever hire people who don't have customer service experience, because you learn so much about life when you do customer service experience, at the fast food or anywhere else. And I think it's a similar thing that I would say about the public health field. I don't know that I would hire someone who hasn't worked in a public health program as a frontline person. And that could be in a school, in an after school program, in a summer camp. It could be as a clinic front desk person. It could be, there's a lot of opportunities in the world to work as a frontline person in something connected to public health. And I think the divide between what the people at the front desk understand about the community and about the struggles of people to get healthcare, to get anything, and what the people in the offices understand is pretty vast. And so I would really encourage, like if I had a public health student who was a master's student who had never actually worked in any low income community or had never been a frontline person anywhere, I would say go ahead and work a part-time job at the park for 8 hours a week for the year. Like there's something to be gained from actually being in real relationship with people. And if you're not in the front line and in real relationship, like it is really hard to replace proximity and relationship with book knowledge. And you can be very, very intentional about wanting to, but it just doesn't happen.
I'd invite Leslie to answer too, if you're interested in doing so.
Yeah, so again, with what Tessa said, how I did start with receptionists, and with one of our clinics, it's right in front of the Ecuadorian embassy. And one of the things that we did see a lot was that a lot of the people did not speak any English at all. So it's just like they would come in and they would think we were in an emergency room or something else, but it helped a lot that I was there and I spoke Spanish to be able to help them and connect them with getting their appointments and helping them get assistance with getting insurance or signing up for like our sliding fee program. And it's like, if you think about it, it's like, well, what if you didn't have someone that spoke Spanish? Then they would have never gotten that service.
You know, there's another thing that comes up for me in my daily work that I think happens throughout public health, throughout public service, is that often people will make a comment, and this is just, and not recently, but I will just lay out a comment like this. Oh, how can they don't need the sliding scale. Look at their fancy purse. Or how can people be so stressed if they're getting these unemployment checks? Like, there is constantly comments that are made within decision-making spaces and within leadership, and I'm not talking about NHS, I'm just talking in general, that display an understanding of how the world works that has to do with poor people work like this, or this works like this, or people don't deserve services, or, I mean, in our world, that healthcare is only for people who can pay for it. I mean, there's a whole bunch of this stuff. And I think that it's a huge skill to learn how to recognize that. And an even bigger skill that I'm working on myself is how to combat that. How do we change that mentality? And it must have to do, I think it has to do with every time it comes up in a meeting, we let it sit there. And how do we not let it sit there? Like, how do we point out, oh, that's not the mindset we have here, even if it's real systemic? And so I think that piece is another piece that I would love to learn myself and to make sure community health people learn, is how do you combat these things in society that really do restrict and hold people away from good health?
Thank you. And in the last moments, we had prepared another question I'd like to hear from you about, and that is, what barriers does your organization have to working with us, either on research or education? Roxana, would you like to start?
We worked for many years with the University of Minnesota, so I think we have found a way. But when it comes to volunteers, the bilingual piece, it can prevent many, if they are not bilingual in Spanish, it would be very difficult to work for us. But luckily, I think the students that are attending the University of Minnesota are becoming more multicultural and hopefully speak more languages, so that barrier would be reduced.
I would say in our relationship, we're starting with the MGlide project, one of the things that's been really helpful is that they understood that it was going to take a while to get it going. You know, so the most that we have to like go back and go through processes and get documents signed and then get another document signed and then change that, and then our staff has changed. So having a relationship with them is only working because on both sides, I think people were comfortable with the idea that it would take a while to get it moving. And so for like a long-term project, that'll work. For the short-term things the students want, I think it's, you know, how can we minimize the amount of administrative work that our side has to do to get a project going?
Thank you so much. And unfortunately, we are out of time, but I'm so grateful that you took the hour to spend with us and in preparation and everything. So should you all out there have any questions, feel free either to reach out to Barb Lux, who has the contact information for these three individuals, or to me. And we look forward to seeing you next week to continue these conversations with our community members. Please join me in thanking the three of them for their time today and expertise. Really, 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 really thankful.
Thank you so much.
Thank you, Roxana.
Thank
Thank you, Tessa, Leslie. Bye-bye, everyone. See you next week.
Bye.
Yeah.